Now, as I said, this stuff is all review for you. So I'm just going to help you remember some of the key points that you're going to need to know. Some of the stuff maybe on your quiz a little bit later. So let's get after it. Okay, what are the sources of law? Does anybody know what that is? Y'all read all these chapters, right?
Case
Constitutional case law. Constitutional law is what, when they say that's against the Constitution or violates the Constitution. Common law, you familiar with common law? Common law, bless you. Common law is law that's set usually by judges. You know, they hand down something, they look at, you know, well, they interpret things a certain way. That's going to be common law or case law. Legislative law, those are going to be laws that are created by Congress. That would not be your constitutional law. Then administrative law is that law that's killing us all right now, right? Administrative boards can make all sorts of laws, and they do that. So they probably have more laws, administrative law, than anything else that's been voted on. Oh, what do I do with that? Civil law is something you need to be familiar with, because civil law is what you're most commonly going to encounter if you have a problem in EMS. Under civil law, we're more concerned with tort law. You need to know what a tort is. A tort is going to be something that's committed one individual against another. This would not be criminal law. If you killed somebody, that's one individual against another. However, physically, it's not seen that way by the courts, because that's going to be a criminal case where the state or the feds are going to bring that charge against you. But tort law is when, you know, you let your dog jump the fence and he came over here and he killed my cat. Now we've got, you know, a tort issue, one against the other. And that's what we encounter most commonly in EMS. Specifically, the ones we're concerned with is negligence, malpractice, assault, battery, slander, that sort of thing. So those are things that we're going to need to be most familiar with. Criminal law, as we said, is crimes against society. So what's a tort law? What's tort?
Individual law. You wrong.
Yes.
Individual against individual and civil.
That's right. It's not criminal. It's usually don't go to jail for any tort violations. If there are any jail time, it's going to be under a year. Anything above that is going to be considered criminal. Most of the time we don't get jail time, but it's a possibility. Most times it's fines or loss of licensure. What's the difference between a certification and a license? Like when you complete National Registry, are you getting a license or a certification?
Certification.
That's a certification. What does a certification indicate? Do you know, Patricia? What does a certification indicate?
Yeah, you can get a license from the state that you pass.
Have some standard.
Yeah, you pass that standard at that time on that day, you were considered competent. It doesn't mean that a year from now you're still competent. That's going to be up to who? Who's going to make that decision a year from now if you're carrying a license?
Well, who gives you the license? So the state
Yeah,
gives you
your
the license.
licensing body, they're the ones that will determine, or with your medical director, if you're still providing decent care. So the certification, if you can think of it like you get your CPR certification. On that day, you took that test and you met that standard. That's a certification. Licensure is something different. Licensure is what a body like the state would give you that says you are licensed, you've met our standard, you've met the administrative requirements, we will now give you a license for some time period. So certification is recognition granted to an individual who has met predetermined qualifications. Licensure, process to regulate occupations. Anybody that has a lot of public contact, they're going to have a license of some sort. It's not just in medical, you know, you've got to have a license as a building contractor, you know. You've got to have a license to do just about anything. So you do need to know the differences between those. Standard of care and scope of practice are two terms that students struggle with sometimes. Standard of care is how you should do something. Your scope of practice is what you can do. So if you can just kind of remember that distinction. Scope of practice is what you can do. Standard of care is how you should do it, the quality of which. Standard of care is care expected from a paramedic with similar training for a patient in a similar circumstance. So asthmatic patients should get essentially the same care, same protocols in Alabama as he gets anywhere else. Do you need to use the phone? You can step out. Okay. So any confusion about scope of practice, standard of care? You got that? It's an EMT thing. I know you'll get some of that on registry. This is in the operations part of that, and 20% of the questions are gonna come from operations on National Registry. So they gotta pull something somewhere, and they are the ones that most students are least concerned with. Ethics. What's the difference between ethics and morals?
Is it morals like what's considered generally right and wrong, whereas ethics is reflection of how things could be
Yeah,
done?
we're pretty close there. Ethics are usually held by bodies, like we're in EMS, so we have certain standards that we adhere to. You know, the patient is always first, you know, they're the most important thing, that's who we're providing care for. That's our ethics. Morals are something a little bit different in there. Ethics, we're not required to do things ethically by law. Can you think of an example where ethically, or I wouldn't say morally, where morally something was wrong, but it was legal to do? There are plenty of instances, right, that you can think of where morally it was wrong, but it was legal to do that.
In a fiction.
I'm sorry?
Oh, are you asking for examples?
Yeah, can you think of anything?
Yeah, in Miami-Dade County, it's kind of a problem with reporting elderly people. Legally, your building inspector is supposed to kick them out of their house because it doesn't meet certain health code. But it's ethically right for them to work with social service agencies to try to keep them in their home and eliminate the hoarding problem.
Yeah, that's kind of the opposite of where I was going with that, but that's exactly what that is.
Adultery in some states.
Adultery is illegal. Is that
No,
what
it's
you're saying?
morally wrong, but not always illegal.
That would be an example, yeah, certainly. And there are plenty of examples along those lines. So if you're looking just for the letter of the law, you may miss how you should behave towards a patient, or how you should manage a patient. You do have to look at your moral obligation and then your personal ethics regarding that. You always use the golden rule, do unto others as you would have them do unto you. You usually stay out of trouble with that. Good ethical behavior. Ethics are something you're going to do when nobody's looking. You know, it's like integrity. It's something you're going to do regardless of whether somebody's watching you or scoring you, or whether it's going to really have a difference in the outcome. It's like you, ethically, your integrity won't allow that. The single most important question you need to ask yourself if you're struggling with a moral dilemma, and you're going to have plenty of those out there. You're going to, probably once a week you're going to have some moral dilemma that you're going to deal with. But if you always look for what is going to be the best outcome for your patient, and you always have your patient's best interest at heart, you're usually going to answer those questions right. And then, if you end up having to go to court over it, if you can explain how you reach that decision based on the high ground, you're going to stand a whole lot better chance of beating that one than if not, if you just go by the letter of the law. Talked about scope of practice, so let's haven't read this one in a while. You're en route to the hospital with a 220-pound patient who's having 15 multifocal PVCs per minute. Can you picture this guy? How's he doing? Protocols call for administration of 1.0 to 1.5 milligrams per kilogram of lidocaine for this patient. The online physician orders you to give 1 gram, 1,000 milligrams of lidocaine. I hope you know that this will harm your patient. What's likely to happen to your patient if you do this? What does lidocaine do?
All the heart out like our
Yeah, this way you may just kill that patient. You don't make you do that. How are you going to handle this situation?
I asked him to repeat the order first off to make sure I heard him correctly.
Yeah, repeat that back to him. What if he repeats it back to you and says, I said, can't you hear? I said, give him a gram of lidocaine. Now what?
I'd probably do the math with him on the phone.
Yeah.
It's probably not the most
Well, let's
respectful
hear it.
thing, but
Give it to me.
well, I'd probably go over, well, we got a 220-pound man, and our state protocols is 1 to 1.5. So
You
really,
want me to violate the state
yeah,
protocol?
I would try and like just kind of urge him along. Like, do you really want me to violate state protocols? And if so, I probably will have to say no.
Yeah,
And I'll
keep-
tell him that. Like, I'll say I'm probably not gonna do this. So can we rethink this?
What's going to be the key to your defense?
The protocols.
The protocols, the biggest thing is going to be, It's recorded line. You know, so you don't have he said, she said. I never said that. They'll pull those tapes. But, so you're saying you're not gonna give it even though the doctor ordered it?
Yes, I would say that to him. I'd probably say, even though you ordered this, I don't feel competent or comfortable enough to do this. Plus, I think it's gonna harm the patient, so I will not give this if you order it again.
And you have a legal responsibility here. If he gives you an order that you know is outside of your protocols or that you feel fairly confident it's gonna harm your patient, then you have a legal responsibility to say, no, I can't do that. But you have to go through all those hoops. Now, in most cases, as soon as you call the doctor on it very respectfully, they'll back down and say, you know, I'm so tired, or I got confused with another patient, or you're completely correct, and then they'll correct that. You know, it's extremely uncommon that it ever happens where they stand by it. But be prepared for it, so you can say, you can't do that. And you're right, be as tactful as you possibly can, because they're gonna pull those, and they're gonna listen to them. They're gonna wanna know that you did everything right. Does anybody have any other, input about that? Yeah, I think that's pretty well the standard. Oh, same one, all right. Repeat back the order to the physician, raise a concern over the dose. You have to refuse to order that, to give that medication. But you've got to document it very well. Besides the fact that it is on recorded line, you've got to document who you talked to, everything that you said. If you go against the doctor's orders, you may have several pages of documentation there. Probably will go nowhere, but I've been involved a couple times where they've had to get rid of a physician at the ER, and so they pulled all this documentation where she was giving incorrect orders and that kind of thing. So it may come back, so make sure you document very well. What's an intervener physician?
Is that the one that shows up on scene?
Yeah.
Okay.
Yeah, this is the kindest thing I could name them, intervener physicians.
I'm a doctor, let me do this.
Yeah.
I'm ordering you to do this.
Yeah. Have any of you encountered that yet? You encountered it? What was your situation?
There was a wreck, and my paramedic basically told the guy, either step off or you're riding in the ambulance with him if you want me to do anything that you say. And he was like, well, I'm not riding in, we're not doing anything until they go away.
Yeah.
He left.
Did he do it respectfully and politely?
No, that was not, it was a little bit of a,
Attention there? Yeah.
but there have been some that I've seen that have just been like, what can I do to help you? Oh my God, y'all are amazing. I don't know how you do such a small thing.
Sir, can you help us control traffic?
Put this yellow vest on, please.
You usually encounter these in two different ways. One, like on the scene, a wreck. I've had them a couple times at the beach, things of that sort. The other way is going to be in the home of the patient, where you've got his mother or her mother, and the physician is there. Mom's called them, and of course they have a personal stake there. So which one of these do you think you're going to have more issues with, usually?
In the home.
Probably in the home, because they have that personal stake there, and they have a hard time separating that. You know, they've got flesh in the game, so they want to make sure you do everything right. So it's much more challenging to manage those sometimes. What's going to be your best way to manage that? Med control. If you ask them nicely and explain, this is what I do, I'm full-time at this, and I've got this, would you mind getting medications or whatever? And if they are a problem in any way, call med control. If you put those physicians on the line talking to each other, they usually can sort that out, and it gets them out of your face so you can work. Yeah, they can be an issue. You're called for a motor vehicle crash near the local medical center. A man on scene identifies himself as a physician, and he begins to instruct you on how to manage your critically injured patient. So you're close to the ER anyway, so yes.
Do they have to identify themselves with like documentation if you call them on it? Like if somebody just says I'm a physician, and you say, okay, can you back that up?
Well, what do you think?
I think that they would have to.
Yeah, because I mean,
Almost every doctor is gonna have their badge in their car though, I mean.
Yeah, they're getting out. Well, the thing is, you don't know anything about it.
that's what I'm saying, if it's a
No.
stranger, it's like,
Yeah.
it might just be somebody who really wants attention.
You can never turn patient care over to somebody that, one, wasn't approved by your medical physician, your medical control physician, and two, you didn't have a really good identification, and three, that you made sure that they understand what their commitment was. As you mentioned, they have to go. They're the highest level, and if they've taken over that patient care, they gotta settle up and ride with you, and then they've gotta write up their paperwork too. So he begins to tell you what to do or how to manage your patient. How you gonna handle this guy?
Starting with
He's getting
David.
tested.
just saying, like, okay, well, what kind of doctor are you, and can I see proof?
I'm an optometrist.
Yeah.
It depends, because like he said, he's an optometrist. I actually had 2 weeks ago, I went to the house of a podiatrist's office, and it was his dad that was having cardiac issues.
Yeah.
He said, I'm Dr. Holstrom, blah, 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 and I knew who he was, but he didn't think I knew who he was. And so he started asking all these questions.
Did he tell you he was a podiatrist?
No,
Or say
but I knew,
podiatrist?
he just said, I'm Dr. Holstrom, and started identifying himself. Which, I mean, I knew that, and so to be respectful, I just explained, what we were doing, but I didn't really let him.
He wasn't a problem.
No, but, I mean, it probably depends on what kind of physician this guy is. I mean,
Yeah.
you can tell an ER doctor because he's gonna have that
Yeah,
type of
usually.
mentality.
Yeah, if you were out on the scene somewhere and Dr. Sim rolled up, you'd probably be comfortable. Yeah, Dr. Sim, whatever
Good
you
with
say,
it.
I'm good with it. He has the ability to do that as our medical director anyway.
I feel like you could tell though. I feel like a podiatrist will be
Right.
hands-on. The Dr. Sin will be like standing back and be like, hey, do this, like looking at the full picture. Like you'll be able to tell the type of
The
doctor.
difference,
Mhm.
yeah. And it depends on, what their stake is too. If they're personally involved with the patient, they don't think straight. So, what do I got here? So are you just gonna do what he says? What's gonna be your first avenue? If he starts telling you, oh, no, you need to do this first, we gotta intubate that patient, but, before you drag him off the road or whatever it is. Initially, what's your first response gonna be?
I'd probably ask him why, I would want him to back me up with as much knowledge about why he wants me to do what he wants me to do.
So you've got a patient that's dying on you, and you're gonna have a conversation?
No,
That's what I was
he's
thinking.
step
Starting
back.
talking about something and not actually getting in there and forcing you to do something. You can do your job while he's just yakking.
Yeah, it's just
Yeah,
a distraction.
I feel like I would tell him that. I feel like, look, there's a lot of hoops that we have to jump through if you want to join us here, but this person is dying, so please let me work.
Yeah. You have to be tactful, because if you really antagonize somebody and they start to fight, if they're very upset about it and they start physically fighting with you on the scene, have you helped yourself? No, so you need to try to keep a cap on it as best you can, and ask them, always start off first, I'll ask them politely, if they come in and say, how can I help you? I'm a physician, I'm putting them to work. I'm not letting them intubate, but they can hold C-spine, they can hold, bleeding control, they can do different things like that. They can get stuff out of your bag. And most of them are good like that, but the ones that want to take over, you just have to kind of back them down a little bit. Give them a job, and maybe they'll stay busy until you can get a handle on things. Is there a point where you might, question?
I was reading, it was talking about there were certain states that they give you a card, and you can hand it to, like, a physician or something tries to intervene, you can give them the card, and everything.
A red card.
I don't know.
It happens here.
It's a
Here,
certain
really
card that
busy.
you can have with
Read
you, and
this.
they can't, there's certain states they can't intervene.
They're putting a penalty box?
Yeah.
Well, that's interesting.
Too big.
I do like the card idea though, because while you're busy working and you can't have time to explain it, here, read this and then get back to me when you feel like you can comply with all these things.
Yeah, they probably won't read it.
No.
But it's one of those, you're just gonna have to handle, each situation as it comes up. But my recommendation is be as tactful as you can, be as calm and respectful as you can, and try to channel them, just like you would anybody else in somebody's home. Channel them so you can put them to work for you instead of,
I think nurses are worse than doctors today.
Yeah, I was about to add that, the nurses and off-duty paramedics, because they had a wreck on the interstate where these two nurses grabbed the IV box off of a rescue truck and started sticking people with IVs. That's a big turnaround.
yeah, it's a big
They
one.
made them pull them out they had to pull them out.
At some point, would you consider calling the police? Would you call
It's a
law
wreck,
Probably
they
enforcement?
should
then.
already be there.
Yeah, but if the nurses are sticking people, that's kind of
Yeah.
Well, the police don't
battery.
care about
They
that.
don't
Yeah,
That's-
yeah, battery on the patient, they haven't battered me. But, yeah, that can easily cause legal problems, but that's why it's so important you document very well. Yeah, important.
But that sounds a lot like, I've heard of people who, like a coworker who was building up his own junk bag for in case he came across an accident or something, the question is, well, under whose medical direction are you working off?
If that
And
happens,
so if a
yeah.
nurse is doing stuff,
They're not working in there anyway. They
Yeah,
have to have a
because they're
order.
supposed to have doctors right there.
yeah, okay.
They don't train like we do to work under protocols, and even in the ER, the doctor still has to be in the ER before they work under protocols in the ER.
You know, and you do bring up a good point about, the jump bag thing. Do not, under any circumstances, build your own jump bag and stuff. You are not covered any time to use that when you're not at work. You're covered under your medical director when you're working. If you're just driving the streets and you come up on somebody and you do an IV, no, you're practicing medicine without a license. There's case after case after case across this United States where medics have done that. Very frequently they're out of state, they're carrying all their junk, it's a really bad wreck. There's been some bad outcomes, they've been sued for it, they've lost their license, they've had, big, huge fines, so it's not a good idea. Just don't even do it.
Not even like BLS stuff, like stopping bleeding.
Yeah, BLS you're okay, but any ALS stuff, no.
Volunteer firemen that are paramedics on the side, have a problem with them trying to start IVs.
They have to be working under a
Yeah, they're not-
medical
they
director, and
can't.
they have to have a duty to
That's
act.
just something that they'll respond,
Yeah,
they'll
no.
be there.
They have to have a duty to act. You understand what duty to act is, right? What are the requirements, the criteria for duty to act?
Being paid.
Is that true? It's not true.
No, because the volunteer
It can be
services,
volunteer.
EMS volunteer
Well, I mean,
services too.
he's volunteer as a BLS first responder.
There's a difference between Alabama and Georgia.
Not
If
just
it's in Alabama,
in other states.
you don't have to unless you're on the clock, you're paid. I forget what
Wait,
it's
that's
like.
If you fall, Patricia, there are a lot of people that wanna treat you.
I
You know what I mean?
I want
They
to-
probably not intubate a live
Does that
patient.
every single
Good
day.
training, right?
We bet on it every
We're
single
cracking.
week. Every single week we bet on it.
In most states, Alabama included, you have, that duty to act includes volunteer as long as you've made a commitment to work that shift. You know, if you're just off somewhere and you are part of a volunteer agency, and you happen on something, then no. Any BLS is okay always. But as ALS, you've gotta have some kind of contractual agreement, whether you're paid or not. And, you're covered under the Good Samaritan, if you're just doing BLS stuff, but not to do any of
I'm
that
thinking of
stuff.
when you have to act, like, I guess, is it in Georgia? I think it's in Georgia where if you're off duty, you don't have to pull over and provide assistance. Or is
No,
that
it's
out
same here, in most
Okay.
places, if you're off duty, you don't have to do that. But when you talk about duty, it can be paid duty or volunteer duty. If you sign up to work a 24-hour shift at, XYZ Volunteer Fire Department, and you're down there and you've agreed to take calls, then you're on the clock, you're just making 0 per hour. But you've made a contractual agreement to do that. It's just the randomness of, I'm driving around and, so for the intervener physicians, they have to be properly identified, they have to be licensed to practice in the state. This is before you could turn over care to them, if you chose to do that. They have to take full responsibility for the patient. That's going to include writing up all the documentation that's required for your service. That means if it's on the computer, it's our Alabama state thing, they've got to do that. If there's something else that's required by your service, they have to do that. So they have to go through all of that as well as accompanying the patient to the hospital. If they're taking over patient care, if you're directing them in some BLS skill, then no. Otherwise, they're in charge. You must clear it through your medical control position, so you've got to call the hospital. If you put those guys on the phone together, it usually works out a whole lot better. But, if you call the ER and they know this guy, Dr. Steen says, oh yeah, I know so-and-so, he's good to go, then you're good to go. But usually they're not going to want to ride in. Y'all ready to talk about consent for a minute? Probably got all this. 1:30 in the morning, you're called for an attempted suicide. On arrival, you find an unconscious 24-year-old female bleeding heavily from both wrists. Okay, you picturing this? Her husband states that he woke up and found his wife unconscious on the kitchen floor with blood all over. He explains that she's been troubled over a recent miscarriage. So you got to picture this. Anybody uncomfortable with this at all? Okay. You and your partner begin treating the patient. You start IV, you intubate per protocol. As you prepare to transport, the husband tells you he wants her transported to St. Mary's Hospital. You explain that she has to go to County General because it's the closest hospital and it has a psychiatric ward. You see any issues with this? What?
In town.
How come?
I don't know. It sounds reasonable.
You gotta support that one.
Well, yeah, she's basically attempted suicide, but for you to make the general assumption that she will automatically be psych ward and then announce it to the husband. It's kind of a lot of information all at once to him.
He wants her to go to St. Mary's, take her to St. Mary's.
She's critical, they've had to intubate her, she's lost a lot of blood. She
She
FTD, do you have a obligation here to go to the family's choice, or you have an obligation to go to the closest hospital?
The closest hospital, nothing to
Okay.
do with the psychiatric part.
What if it wasn't the closest hospital, but we're going there because they have a psych ward?
Then that's
It's
just
a
your
trauma,
call.
it's a trauma first, psych second.
Mhm.
Say she wasn't really critical, but you want to take her here because of the psych hospital.
And it's up to her, the husband, it's actually, if she's not that critical, she's conscious, so ask her.
May not be conscious. You mentioned EMTALA. What's the EMTALA issue here?
Patient dumping.
Do what?
How many does that have to do with patient dumping?
Yeah, and what exactly is patient dumping?
Taking them to a hospital so you don't have to deal with it. Or taking them to the cheapest place because they don't have insurance.
Exactly. Just because this is a psych hospital, do you know that this is a psych patient? No. What else could it be?
A murder.
A murder. Yeah, we don't know that. And of course, you don't automatically assume the worst in every situation, but you do have to keep your eyes open here. So we've got several things going on. He wants her to go to St. Mary's, and of course, if I go down here, you know, I might have a certain place I want to go to or not. And everybody, you know, usually has a place that they prefer. So that's not unreasonable. Closest hospital is County General. So let's see where we go from here. So there are a lot of issues going on here. He continues to insist that she go to St. Mary's and refuses to allow further treatment or transport until you agree. So now we have an aggressive person, a hostile fellow. He insists she goes to St. Mary's. It could be he's had a really bad experience in county and he believes, you know, everybody goes there to die. They're killing him over there. So he may be reasonable in, you know, wanting her to go somewhere else. We're going to St. Mary's?
Yeah,
St. Mary's.
Why?
I don't want to do life.
Because I wanted to get.
Personal safety, is that what you're saying?
Yeah.
Give it a good
Yeah,
effort.
just
Give it a
don't
good
do it.
effort.
It also depends. I mean, county might be 3 miles and St. Mary's might be 4, so it might not be that big of a deal.
Where are you transporting to?
Well, it depends. If St. Mary's is really far away, and we
That's
say
fine.
your one unit is
You're
only
gonna call
if
somebody else.
taking your unit out of circulation for far too long, for
You're gonna work
on
sure
the
on
other.
the
The patient's dying, you can't take them there if it's that
If
far
it's in
away.
your service area, you transport there. So that really isn't a consideration as far as the distance. It's in your service area.
I think it would matter too, if some places, if suicide is called out or a possible suicide, then police respond also. So, I mean, if the husband's getting, facing the police is there, then I would let the police handle him and I would still take the patient to the closest facility.
Yeah, and that is how you handle that if you had law enforcement on scene. But it just went out as, you know,
Just a regular,
yeah, who knows, someone bleeding. So law enforcement's not there. So who's going to transport to St. Mary's?
well,
Show
law
hands.
enforcement's not there, St. Mary's it is.
Okay, who's transporting to county? Who's not going anywhere? You just like staying
I don't
there?
know.
Just let her bleed.
You voted? Okay, St. Mary's. all right.
She was looking at me.
You just don't know?
I don't know.
You're gonna have to make a decision. We're paramedics
I
in
mean,
here.
what kind of
We are not
hospital is
nurses.
this? Is this like a baby delivering hospital? Is this St. Mary's place where
But
they
she
don't
did
do
have a recent
anything?
miscarriage.
It's
Is
just
this
some
like
other-
Jack Houston? Because I mean,
Well, it doesn't matter, we had to take an arrest to Jack Houston because that's.
If it's closest hospital and has an ER,
yeah, but this isn't the closest hospital. If this St.
well,
Mary's
St. Mary's,
place,
I don't know what it is.
Yeah, I mean, if it's
Doesn't
like
matter.
Jack Houston, and I'm gonna be trying to talk this man, and he's crazy.
A crazy man?
Yeah, if
Well, I mean,
he
you
wants
figure
his
she
life
can't
to
make
go
the
somewhere
decision.
like that,
She can't make the decision, he's her.
That's gonna be your bottom line is you're going under the doctrine of implied consent. Any reasonable person would want transport where?
To the closest.
The closest hospital in this situation. If you're having to intubate her, there's blood all over, she's unconscious, yeah, she needs to go to the closest hospital, but now you have this man that's a problem for you. Anybody have any innovative ideas on how you might
You
manage
could call
that?
medical direction, but then it's gonna.
Absolutely gonna call medical direction.
He's probably gonna say go to St. Mary's.
Well, we hope not. Well, legally, if he says that on the recorded line. So anyway, let's see where this goes. Would you consider putting her in the ambulance and telling her you're going to St. Mary's and then divert to the closest hospital?
No.
No,
No.
don't lie.
Thank you. You decide to transport to St. Mary's because of the family's wishes. The patient is treated and released the next day. 3 days
Saved her.
later,
That's another crew's problem.
excuse me? 3 days later, you find out that another crew transported the wife for a sedative overdose that proved fatal. Okay, we killed her.
That's their problem.
So now you think you should have transported to the psych place, should have gone to county?
Because they should have recognized it and transferred her to the psych
Yeah.
hospital.
Because we're always there to transfer to another facility.
So the implications of implied consent versus the wishes of her husband, which one should you do here?
Implied consent.
If it's something serious like this, I would probably go under implied consent. And over the course of your practice, you're going to have times where the family's saying, I had a family one time that wanted us to take this stroke patient from Fairhope all the way around the bay to Providence. I don't know if you guys know anything about the Mobile area, but that's about 45 minutes to an hour trip. And the guy was FTD. He had he had a bleed. So we stopped at the hospital there in Fairhope. She was not happy. But the patient actually survived. Yeah. We assume that unconscious patient want to be treated appropriately. This includes being transferred to the most appropriate facility. But you can't factor in the psych thing. So you just got to take that out. That's an EMTALA issue. You can't take them there because you assume it's a psych issue. He could have tried to kill her, and she didn't need to go to a psych facility. He did. All right.
Yeah, we didn't think, what if county was just a regular hospital, but St. Mary's was the trauma hospital?
Well, that's not usually the case. But still, closest hospital, she's fixing to die. You've got a code going on, you know, you go to the closest hospital. So, anyway, I thought I wouldn't like kill you with 500 slides about this one incident. Okay, let's look at consent. Did I go back too far? Yeah, I already did that. All right, let's look at negligence. What are the 4 parts of negligence? There are 4 components to negligence that have to be met. You know what they are. What are these? All right, we've got the first one up there, duty to act. That's, try to give them in order. Hang on to that one, we'll be there in a minute.
Do that, proven, breach of duty.
Breach of duty, yeah, these go in teams. Duty to act, breach of duty. Okay, what is it? Proximate cause,
Damage to patient or other individual.
patient must have suffered damages. Yeah, so those 4 components must be met in order for them to bring a successful suit. You can be sued anytime for anything, but for them to be successful, they have to meet those 4 standards. So the duty to act, as we said a minute ago, is either formal or informal, paid or volunteer, but you've made some type of contractual agreement. Breach of duty really has 2 parts of it. Breach of duty is that you have got to have provided a certain level of care as an equally trained paramedic anywhere else would be. So that means you've got to if you either do the wrong thing or you are absent and you don't provide the service that you should do. Either one of those can constitute breach of duty. Damages. There must be damages. Some kind of damages must occur. And damages include physical, financial, or even psychological harm. This is that patient that if you say, if you don't shut up and sit down, I'm going to grab the biggest IV catheter I can find, and on my truck it's a 12, and I'm going to stick it in the smallest vein you have. So, is it possible I psychologically harmed her? Yeah, I mean, she won't call 911 for the rest of her life because she's so scared I'm going to be on the truck. Then yeah, that's some psychological harm. Okay? Proximate cause. This means you had to cause that harm. If you have a patient, say, that was involved in a wreck and they've got numbness, tingling in their fingers and toes, but they refuse to get on the long spine board. They won't let you put the C-collar on, won't let you put on the long spine board. They let you transport them to the hospital, then they have a bad outcome. They try to sue you. What about proximate cause? Have they met that standard? No. you told them this is what we need to do for your benefit, they refused, so they were the cause of their own harm. I mean, they caused the wreck themselves, they were in the wreck, not you, but then they caused it to be worse. Sometimes they may split that if they see that you are partially at fault, then you may end up with some of that on your back. An action or inaction that immediately caused or worsened the damage is called proximate cause. So even though they were involved in the wreck, they had initial spinal injury, but if you fail to put them on a long spine board, you fail to put them on a C-collar, and it worsens their situation, then yeah, they've met the standard here of proximate cause. Does that make sense? All four components have to be in place for them to be successful with that charge. Okay, come upon an accident that just occurred. You find a patient who has traumatic asphyxia. You have your jump bag with you, so you proceed to intubate the patient while waiting for the ALS crew to arrive. Okay, what are we guilty of?
Doing it wrong.
Poaching?
Not
Practicing
being
kind
a
of
good
life.
Samaritan.
You later find out that the patient was brain dead on a respirator. The family states that you should have not attempted resuscitation since he was already brain dead and would have been pronounced dead by the ALS crew when they arrived. Okay, are you in hot water now?
Yes.
Yeah. Can the family sue you?
Oh, yeah.
Yeah. They'll probably win that one. And not under negligence because you didn't have a duty to act.
No, emotional trauma or damages.
Yeah, this is an actual case out of Florida when I was living down there. Off-duty paramedic from Tennessee stopped after a bad wreck on I-10. The patient had been ejected, the car rolled over on him, and he was like basically dead. Well, the medic had all this stuff in there and intubated the patient. He saved the patient's life, but at that point he had been a vegetable for about 4 or 5 years before it actually went to court. And he lost, and he had to pay, he lost his license, he had to pay a lot of money. That guy would have died, the family would not have had any more financial obligation there. So he was way out of his league. So when I tell you, don't carry that stuff with you, because the temptation is too great to use it. Just don't do it. If you want a bag valve mask, that's fine. I carry a pocket mask, gloves, and a towel, and that's about it. I usually have my stethoscope. Performing any procedures that require delegation from a paramedic, from a physician, which any ALS skill requires that. If you're doing that while you're off duty, you're practicing medicine without a license. Designated agent. I don't know why that's a term everybody has trouble with. Designated agent is the way we function under direct supervision of a physician. We're his designated agent. So when you see that word on registry, know that that's the way we practice. We're his designated agent. When I say he, it's interchangeable, he or she. It just flows out of my mouth easier.
So we call ourselves agent on the truck now? Special agent.
Yeah. Yeah. Well, it sounds more like an insurance agent.
Special agent, paramedic, Virginia.
What is res ipsa? Res ipsa locator. What is that?
Nope.
It's on the next screen. I should have blacked it out. Res ipsa.
Some law term.
Yeah. Usually they do it.
Yeah, I just saw it when you flipped
Yeah.
it.
Good, you were paying
The law
attention.
term.
The thing speaks for itself. Absolutely. It could not have occurred in any other way. Y'all know these. This is an example from a surgery. I guess somebody had some, I don't know. They left an instrument in there. Could you have done that to yourself? Left that in your back? Probably not. That would be a difficult one. In this case, patient continues to have pain from an appendectomy and has an x-ray only to find the surgeon left a surgical instrument in the abdomen. Damages could not have occurred outside of the physician's negligence. The instrument was under the physician's control at all times. That doesn't mean it was in his hand, but he was responsible for everything that goes on in that ER. The patient did not contribute to the injury at all. That's res ipsa.
We're all gonna lose our license for that then.
Do what?
We would all lose our license for that.
You're talking
Yeah.
about the surgery,
Everybody
right?
goes down on that one, probably.
Everybody. Well, the nurse, the scrub tech, and the physician.
You might lose your job. The big guy's probably gonna
Yeah.
cough up a lot of money. It'll be very unpleasant. Comparative negligence, I kind of touched on this a minute ago. You have a patient who injured his neck in a wreck, he refuses spinal mobilization even after you've explained the risk of refusing. That's a key element. You have to explain to them, you have to educate them. If they're going to refuse some kind of treatment, you have to let them know what the most negative outcome could be. In this case, if you didn't tell him what could happen, he has a bad outcome, he goes to court, he's gonna say, they never told me that it was really important. They never told me that I could be paralyzed the rest of my life. So that one small omission may be the difference between you paying a lot of money and losing your license or not. So you must understand you have to educate your patient. The patient signs an informed consent form. Just because he signed an informed consent, does that mean he's been informed? All that means is you ask him to sign on the line. How many times have you clicked, I agree to the terms when Apple wants to update, or Yahoo or somebody? Yeah, just come on, update. Same thing here. Get out of my face, I'll sign anything. That's not legally binding it. You haven't fulfilled your part of the agreement. You have to educate your patient. Patient later learns he has a permanent spinal cord injury, sues the paramedic for negligence. He gonna win that one? He might. The patient refused the necessary treatment. If the patient is found to have caused or worsened his own injury, he's probably going to lose that one. He's culpable. Okay, next scenario. Your patient, Bob, left off the column, has been having crushing substernal chest pain radiating to his left arm for several hours. He's cool, pale, and diaphoretic. He denies shortness of breath. Put him on some oxygen, give him some nitroglycerin. When you ask him which hospital he wants to go to, he refuses. So what's your job?
Well, I don't know,
He's gonna
why
die.
is he refusing? Like, is it money, or is he worried about paying a bill? Is he worried that the dogs won't be taken care of? Like, why is he refusing?
You've got a whole bunch of steps you have to work through here. The understanding of why is an extremely important component of that, so that you'll know how to counteract that. But besides just finding out why, that's going to help you, counteract that. But what are your other requirements here? If you're going to take a refusal, what, Patricia?
Explaining to him he could die.
You have to explain to them the seriousness of their condition, and you have to give them the worst case scenario. It's not just, well, you could bleed for a while, it could get really messy. If it's something that, if you've read a case somewhere that somebody's died from it, then this could kill you. They're looking to you for your medical knowledge. You've got 2 years of education here, so most of your patients you're going to know considerably more than they do. So it's incumbent upon you to educate your patient. Say this guy refused nitroglycerin. You got to explain to him why I need to give this to you, what it's going to do to you, side effects, but also how it's going to help you, and what may happen if you don't take this or whatever it is you're trying to give them. You got to educate them. If they still refuse, now we're going to go to the other things that you can do. Besides trying to find out why they're refusing, what else can you do? What are your other options?
Get a family member of the doctor to
Talk to a family member, see if they can talk them into it. When you say doctor, who are you speaking about? Yeah, you want to call the hospital, put the ER doc on there. They may be able to talk them into it. All right, we've done all that. What else do we have to do? We're ready to refuse. They're absolutely adamant. They're not going.
Make sure they're conscious of their condition.
You absolutely have to make sure that they meet the legal requirement of being conscious, alert, and oriented. They have to meet that legal standard. So you've got to make sure that they know what's going on. They have to understand what's wrong with them. They have to understand the care you're going to give. They have to understand what's the worst case scenario, what will happen to them. So you absolutely have to get that. You have to document that. So what else, your requirements? What about if you change your mind? Yeah. If you change your mind, you can call us back. I'm not paid by the number of patients I transport. We're just down the street. Call us back. What else should you do here too? In addition to changing your mind. How about a mother that's refusing for her 5-year-old that fell off a swing, and you're concerned that you're going to have a head injury or bleed, and she's saying, no, we're just going to, sit on this and watch him for a little while. My husband's home this afternoon, and we might take him up there. Got any input there?
Police custody, that's kind of a last resort, isn't it?
Well, that might be a little bit extreme.
Tell them what to watch for.
Well, we want to try to get our paperwork signed. Yeah, you want to tell them, if this gets worse, this is what you're looking for. If you're trying to weigh or getting worse or not, how many of y'all been in that situation, seen a physician and said, well, if it's getting worse, this is what's going to happen. Like you might, when you're being released from the ER with a fracture, they may go into the whole thing about compartment syndrome. If you start getting this, you start getting that, or you may have heard that on television, you take this med and you start getting short of breath or blah, 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 then you need to get to the ER. Yeah, call your doctor, not even going there. But yeah, you've got to tell them, you know, what to expect. If this thing is what it could be, these are the signs and symptoms you're going to see. If this happens, you need to call us back right away, or you need to get to the hospital right away. So you have a very hefty, heavy legal responsibility anytime you take a refusal. Okay, so this guy refuses to go. You can't imagine why someone in that much pain would refuse to go to the hospital. He enlists the help of relatives, they can't persuade him. He doesn't have a physician, and your online medical physician is unable to convince him. Can this guy refuse? Because he's a conscious and alert and oriented, right? He can make decisions for himself. What should you do? After you've tried everything else?
Get a signature and get somebody, a family member to.
Yeah, make sure you get that witness. There are going to be times where you're not going to be able to get witness. That's okay. That witnessing of that, or even a signature of that, while that's important, it's not a deal breaker. As long as you can document why the patient didn't sign.
But just say, a while ago you said you give them oxygen and you give them nitro. You've already done an intervention with the medicine, so it's.
So what?
That'd be a tough situation. You've already given medicine and now you can't monitor them to see how he's going to respond to that.
Yeah, I'd just say that I've given you this medication. We really need to be able to monitor you after you've had this med. This could drop your blood pressure and you could like pass out and die right here. You gave me medicine and killed me. Ah. Just because you've given a medication, that doesn't give the patient an obligation to be transported. He's accepted that care, but he can even refuse transport. On their services, they'll go in, they'll start an IV, get some D50, and they leave. And they're okay with that. So.
Maybe sign a bill for them.
Sign a bill?
So we can go
Yeah.
use medicine.
Yeah. Hopefully you can get a signature, maybe not. So after you've exhausted everything, you've tried everything you know to do to convince the patient, they have the right to refuse. And they can refuse at any time. You know, you can give out partial care and then they refuse. You can have them in the back of the truck and they say, stop, let me out. That's all it's done.
Has that happened to you?
Yeah, yeah. I'll let him go. So the elements of informed consent, we've already talked about those pretty much. They have to know what you suspect is going on, what you're going to do for them, worst case scenario, that kind of thing. Do you have a question, Michael?
No.
You just waving in. Is it getting late? I don't know what's going on. You may take a break in a minute. So they have to know the nature of the illness, what you're going to do for them, the risk, benefit, factors, any alternative possibilities. You know, sometimes if they're not absolutely critical, you can say, well, is there somebody here that can drive you to the hospital? Do you have a friend or somebody or a relative that can drive you? Don't do what my friend did one time. They didn't want to pay the ambulance bill, so she and the ambulance followed the car with the family in it all the way to the hospital. Don't do that. What can be a problem there?
You get another call, you have to leave.
Yeah, when you leave that house without a patient, you're having to go 10-8. Yeah, I'm ready for another call. Yeah, don't do that. Okay, hey, let's take a short break. It's 10. How about 10 minutes? I'll flood on out of here. If you come back before 10 minutes, we'll get started.
Is the cafeteria open yet? I don't remember.
Heck no.
There is no cafeteria. Like, it's not open yet until next month. That's why we're making such a killing. It's my hamburger. There's snacks in the bookstore.
You wanna go?
Where?
There's snacks in the
Patricia, there's a snack.
No, I have is $5.
There's a snack machine too.
Listen to your stripper fund and pull that out.
Should have gotten my check on Thursday. Hasn't come out
Top
yet.
of all the, as long as they have it.
You wanna go to
Our hands are-
Would you like a fancy quarter or a card?
I brought lunch.
That's the mail to grab home.
At least I was
I
getting
don't
worried.
think so.
I was like, I need to
You wanna
text
go
you to
to
make
the
sure
bookstore?
everything's okay without getting blue.
A little blue's okay?
Oh, I'm not exit, it's already graduation.
That's how we went.
I forgot to text you already. Yeah, I forgot that I had to tell somebody.
Yeah, it was great.
Understand.
gonna
That was
create that.
verbatim.
Make sure I go from current slide. Good work. Okay, any minor who is this is from the Alabama State Protocol, I'll put it in here for you. Any minor who's 14 years of age or older, or is graduated from high school, married, been divorced, pregnant, can give effective consent to any legally authorized, whatever. And the consent of no other person shall be necessary. Now, this part of it, from or down, what type of person is this, basically? Pretty much you're looking at emancipated minor, right? It kind of fits all those standards. It can also say if they've been, made an emancipated minor. But the one I wanted you to see was any minor who is 14 years of age or older in Alabama can consent. And this is important because if you had a family situation, you've got a 14-year-old, and she says, yes, I want care, and her parents say no. Remember, the age of consent is 18, and parents can refuse for kids, right? But at 14 in the state of Alabama, the child can say, yes, I want care, and you provide care against the wishes of the parents. So that's an important concept that you need to be familiar with. Everybody okay with that? Sometimes I forget what that age is, but it's 14. Now, they can't refuse care, but they can ask for care against the wishes of their parents if they want. Withdrawal of consent. You have a patient you're transferring to the ER for chest pain. You tell them you need to start an IV to give him some medication for the pain. He initially says okay, but after you make one attempt, he refuses. You explain why you need access, but he continues to refuse. Can he refuse? Okay. Because why?
Because it's his body.
Yeah, it's his body. That's self-determination. So what are you going to do? He refuses. He's got chest pain. You don't want the big MI and, working the whole code right there. So what are you going to do?
Tell them what they need to do.
Yeah, you got to go through all those refusal things. You got to tell them worst case scenario, why you need to do it, good for you, bad for you, what's going to happen, outcomes. You also going to have to get them to sign that they refuse to do that. You need to document that extremely well. You ever had a patient like that? I can think of lots of times, not for me, where the medic stuck that patient 3 or 4 times. It's like, that's enough. I'm going to have to die because you're going to kill me. Stick at me. What if you have a patient who changes his mind about being transported after you're underway? Can you let him out?
I mean, you have to. It's not like you're an officer of the law.
Oh,
But you
yeah.
also, I feel like you also have an obligation, you can't put them out on the side of the street.
So would you take them back home?
I'm not taking that one.
Yeah.
You have an option, either you get them out here or you go.
I believe I'd have to just take them on.
So they can get out.
You're going to take them on against their will? They're saying, let me out, let me out.
I'd probably, I don't know,
They
keep the
sign.
conversation going.
You go
Oh,
pull
yeah.
over in the middle of the
Yeah.
Like, are you
busy
really sure about this?
intersection,
Let me just call my doctor, and we're still trucking.
This doesn't happen, when you're expecting it.
We're
This is
going
going to
to
happen when you least expect it. You're sitting there, and the patient all of a sudden says, I don't want to go. I don't want to go. You got to let me out. You got to let me out now.
You got out of line.
While you're moving?
No,
You
stop.
go outside, go to the back, slow down.
I'd spray some burn in.
What are you going to do, Patricia?
I guess I'm gonna take them to the safest place and let them out.
Well, no, that's a thought. The safest place, that would be.
Gas station parking lot ain't gonna let them out on the side of the road.
So are you going to call anybody? Dispatch? I had to offload my patient. They were
You
really
need to call
a pain in
med
the neck.
control.
Call med control?
I'd call everybody to cover my foot.
Yeah, before you let somebody out, you need to call everybody, absolutely. I'm gonna start with med control, see if they can talk. It's possible he's not gonna be patient enough to wanna talk with the med control. But if you can get them to talk, that's good. Another thing you wanna do, probably you may check with law enforcement. Depending on the circumstances. If it's the middle of the night on an old country road, on the interstate, I'm not letting a guy out on the interstate. So I'll probably call law enforcement, and as Patricia suggested, get to a safe place. If they can call somebody to pick them up, that's fine, but I'm being a little bit uncomfortable about just turning somebody out and then they had a bad outcome.
Do they still get billed?
Yeah, they get my bill. They took my time. Okay, what is the relationship between a signed refusal form and a patient refusal? 100% relationship? Are they the same thing? Are they different?
One is actually signed.
Do what?
One is actually signed, the other one is just, I mean, they're saying that they refuse and they don't want to sign it. That's verbal. Verbal is.
That might be part of it. What's the relationship between these two?
One document.
Not necessarily.
I mean,
Both are refused.
Can you think of a circumstance where you have a signed refusal, but the patient didn't really refuse?
yeah.
I used to work with a guy, he just had chest pain patients, especially when it interrupted something he was watching on TV or something he was doing. So he made sure he no-loaded all those patients because they were paying the neck for him. So he got a signed refusal on just about every one of those patients. You don't really need to go. That's just indigestion, da 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 da. So he got a signed refusal. He got a signed refusal, but the patient didn't really refuse. So those are two different concepts. So you can have a refusal. You can take a legally binding refusal as long as the patient has refused, even without a signature.
What if a patient refuses your treatment and then also refuses to sign the refusal?
I've had that. They just throw the pen. I'm not signing your blank, blank, blank form through the pen. What do you think you'll do?
No,
What if they
it,
sign
no,
a
back in
refusal?
service,
Document it.
that's needed.
Yep, you're documenting that. Patient was adamant that he not sign the patient refusal form and threw the pen across the ambulance, striking the back window. Is that pretty well described what took place there? Yeah, you'd be covered in something
What if
like
they
that.
sign a refusal, then afterwards they want to be treated?
They just call back.
Not
What's
really.
the refusal?
I mean, like, you haven't left yet.
And they don't hesitate to call back either.
Oh, that's fine. Brian, if they, yeah, you just tear it up and ditch it, and you just move forward and say, you know, let me know if we need to revisit this. But yeah, it's not a permanent document. You know, once they've signed a refusal, that doesn't mean, you know, that you can't go back there if they change their mind. That was a good question.
And if they sign a refusal and then they become unresponsive, then the refusals out the window.
Yeah,
Pretty
it's in
much,
white.
yeah. Yeah, pretty
Unless
much.
they're just really
Oh
stupid.
well.
So sometimes patients are coerced to sign a refusal form. Sometimes the medic doesn't go through all those steps, you know, explaining to them. If you don't go through those steps, that document they've signed doesn't mean anything. It means nothing. It's not legally defensible. If you've not gone through your part of it, it doesn't matter if they sign it 50 times and everybody in their household signs it. Who's the better person to get to witness your refusal?
Family member.
Family member, because
They're
When
unbiased.
you get fire or your partner to sign it, then you guys were in courts together.
yeah, there's always a chance that one of the other people on your side of it might.
The game's only 30 minutes.
I get a copy signed too. Because in court, the judge will be like, oh, I'm gonna throw some typo, everybody in here.
Yeah, not so much. You receive a call for a drug overdose. Concerned family members tell you the patient took an overdose of medication. Your assessment shows the patient is alert, oriented, and denying he's taken any medication and he refuses treatment or transport. You know this patient?
Yep.
See
we've
what's
had
going
that
on
happen.
here? How are you going to handle this? The family's adamant. He took all the meds in this bottle. Whatever
Is
it
the
is.
police involved?
Not yet. You gonna call the police?
If he's not
I
gonna
guess I would
go,
ask
He has to
family.
wait around until he,
I'm not gonna sit there with him until he passes out.
I
What's,
guess
what's the police gonna do?
Nothing. I call med control, and then if he's completely alert and oriented, what do you do?
Well, you got different things going on here. Who do you believe? One of these people are not telling the truth, right? Do you know who it is?
Ask
You
the
don't know.
family how they know. How do
I'm
they know?
holding the bottle and it's empty.
Were you there? Did you see it? Like,
Yeah.
I mean, is there a
I
prescription?
saw. I told you. I saw him take it.
I
He
mean,
took. He just went like this. Look at that gun. Just wash it all down with the beer.
polygraph.
I got one in the truck. So bringing that one up. So you don't know, right? But what do you know for sure? Your patient is alert and oriented and denying and refusing. So this is-
You might be concerned about this, but otherwise you have nothing.
You're taking a refusal, right? In this case, you need to make sure you document everything. You got to document what the family said, because this looks like a family issue. You know, maybe he did take all this medication, You know, he wants to kill himself, and the family's trying, you know, to assist him in not killing himself. Or it could be the opposite. Family wants to get rid of this guy. We got to go off for the weekend. He's a pain in the neck. Get him out of the house. We're going to Florida. So you don't know what's going on here. Patient is alert and oriented. You have to go through. You have to go through all your refusal steps, just like you would with any other patient that refuses. You got to make sure you do a full assessment, get a full set of vital signs, and then go through all your, this is what could happen, not sure what you took, this could kill you. You go to the hospital, they can clean out your stomach. You don't have to tell them how unpleasant it's going to be. But you have to let them know, and then you have to get a signed refusal and get it witnessed.
I know most services, if you get a refusal, you have to have at least a set of vital signs for a refusal.
Oh, you absolutely should.
But if they absolutely refuse to
Can't do it. Patient absolutely refused and wouldn't allow us to touch him to get a set of vital signs. However, I could see that the patient had no respiratory distress. Patient's pupils looked good, skin was good, he was well perfused. He was able to speak in, you know, full sentences. He was alert and oriented. He knew who he was, what was going on. He said he hadn't taken any medications, blah, 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 blah. All that is covered in your butt. Really no other reason. And over the course of time, if you do this long enough, you will be called to court for something. So you just hope it's one that you've documented very well and save your bacon. What about an intoxicated patient? Can he refuse?
Well, I guess
Depends, huh?
Has he had 1 beer or 12?
I don't know. I didn't
Only
say drink
two.
it.
I guess it's not so related.
Here, the main thing you're looking at is with any patient, are they a threat? You know, could they have a bad outcome from it? If they've had 1 beer and mom wants them out of the house, so she calls 911 because the guy's had a beer, you know, that's a police issue, right? But you're going to check, is the patient alert and oriented? You know, are they well enough? Can they walk? Can they talk? They know what's going on? You know, if you've got somebody that is staggering around, they've got slurred speech, and they're absolutely adamant that nothing's wrong, I don't want to go to the hospital, but somebody called because they saw him fall, you leave that patient. He has a bad outcome, he's an alcoholic, he gets a brain bleed. A brain bleed, you know, he's handicapped for life. Are they going to sue you? Family probably will. Yeah. So it's going to go back to, is he alert and oriented? Does he know what's going on? Can he make a legally defensible refusal? You hate to take drunks to the ER. I hate to take drunks to the ER. But
We took one Saturday for nothing. He said that he called for difficulty breathing after being kicked in the side. And when we get there, he comes outside, walked outside, walked into the ambulance, speaking in paragraphs, was not having any difficulty breathing. He just wanted to go to the emergency room because he was out of beer.
yeah, they don't have beer there.
Yes, they do.
Some
Absolutely.
DC.
Absolutely.
Yeah.
They give you one.
In the ER, it comes with the lunch tray. Show does.
If you have DT condition.
So you're going to have to make this judgment. You can always get law enforcement involved. You feel like it's necessary.
He's saying to us.
Do what?
He's saying to us.
You also have to look at the conditions under which you were called. If law enforcement called you because this patient has had some type of trauma and he's drunk, then you got to look beyond the drunk and look at the trauma and recognize that, of course, a patient that drinks a lot can have a worse outcome from the trauma than somebody that doesn't drink a lot, right? So anytime.
What if he's belligerent?
I'm sorry?
What if he's belligerent and unmanageable?
He can have a head injury. Then police can you can either restrain him, call main control and restrain him, or have police do it. Yeah, it's a difficult one, but you're better off oftentimes to transport than not if you have any questions. But call main control, put it on their back. The patient must be able to understand the nature of his illness and the consequences of refusal. That is the legal constraint that you have. They have to understand the nature of the illness and the consequences. They have to be able to understand that. Okay, mandatory reporting. There are a few things that we absolutely have to report. Any type of abuse, child abuse, spousal abuse, elder abuse, sexual assault has to be reported. Gunshot wounds and stab wounds, mandatory reporting. Animal bites, communicable diseases, you have to report drug use. Do you have to report that the patient was drunk?
Yeah, I guess you probably shouldn't unless, yeah, that's, you should be tactful about it because that could be slander.
Yeah, I always like to tell my patient that I'm not in law enforcement. I don't care if you're taking drugs. I'm not going to report that you're taking drugs, but I need to know what you've taken so that I'll know how to treat you. And they say, I took, 10 Loratab. Now what have you got?
An overdose,
I've got what?
a possible overdose.
Yeah, so I've got quotes here. I've taken, 10 Loratab or whatever it was. I've got a quote from the patient I can put in there. I'm not calling the police and telling them he's, whatever, but I've got a quote. The patient said he only had 3 liters of beer or whatever. Excuse me. The big liter bottle.
That's what I was thinking.
Oh my God.
You have a 19-year-old male who drove his motorcycle into a tree and he's showing symptoms of a head injury. You ask him several times if he's been drinking or taking any drugs. He repeatedly denies it, although you are confident he's got something on board. How are you going to get this information from him? Brian, how are you going to get that information from him? You can't assault him or batter him in any way.
No, Corbin Blue would just smile his Disney smile at him.
Come on, tell me, offering money.
Money, I'll pay you if you'll admit to taking drugs. Yeah, what do you say to him?
Brian's best defense would probably be buddies with him.
What
Oh,
is-
he's a friend of yours?
No, not to say that they're already friends,
I was like, what?
but that like get on his buddy side, like friend him.
Do I
like-
really need to know though? Is it pertinent to his care that I know?
It might be. In some cases, yeah, they're taking a bunch of different drugs, and you want to give them a medication, you need to know what he's taking. But yeah, that's part of getting your history. Yeah, you need to know what he's
I mean,
taking.
you can always look, if it's like prescription stuff, then he might be in the system already and you can recall the information.
Well, I probably
but
don't
it's-
carry around anything that's going to tell me what his prescriptions are. I don't do
Yeah,
that.
in the computer, you can recall your information and it pulls up your previous and you
Oh, if you
already.
call
Previous, yeah, if it's a previous patient.
That's
yeah,
what I'm saying.
I may not have that information. But how can you just, in a tactful way, get that information from the patient?
I mean, tell them, and sooner or later it's gonna show up if you take draw blood work.
You might as well tell me now. You tell me now and tell me later. Tell them you
I
really
would
need to
tell
know.
them because my treatment might kill you if you're taking the wrong stuff.
Yeah, I would go from that standpoint. I need to know what you're taking. I don't care. I don't report it to law enforcement. I need to know so I can give you the proper care. Usually that works pretty good. Do you have to inform the police what the patient told you?
No.
No.
It
All
falls
right.
under the confidentiality stuff, doesn't it? The HIPAA,
Yeah, yeah. You have to be real careful about that.
whatever.
You have to be careful about what you tell law enforcement on scene. They can subpoena your records, so they can look at anything that, if it's important to them. You can't tell them you suspect the patient was taking drugs, a head-on collision or whatever. You can't tell them that. Probably body language, you might do something, but you can't just tell them. They're recording everything these days. Okay, this is a situation that you're probably going to encounter. You're a paramedic with a paramedic student on your shift. Your student only has 1 shift left before graduation and is a little short on experience. You have a bad chest pain patient as your last call of the day. Who's responsible for this patient?
The paramedic.
Okay, so make sure you do that. En route, you allow the student to attempt several unsuccessful IVs before you reach the ER. At bedside, a physician asks you why you didn't get the patient any morphine, to which you reply that your student was unable to get the stick. Do you want to have that conversation with the physician?
No.
No. You certainly do not. How many sticks you allow the patient before you step in? 1, 2.
Well, depending on what happens, if they just blatantly missing veins here, then I'll give 1. Now, if they just, the vein blew because it was crappy, I'll give them more than 1.
What other criteria would you use?
I mean, if the patient's gonna die right now,
Yeah.
then
Yeah, you're ultimately responsible for the patient and the patient care and, of course, their outcome. So if it's a critical patient, I might give you 1 shot, but know that you may not get a shot. Things are going down that quickly, you may just watch in this case.
You get 1 arm, I get the other.
Yeah, give it a
Whoever
shot.
starts an IV first.
I've never given a student more than 2 sticks. If you can't get it 2 sticks, you need to go find another job, probably. But yeah, if it's a critical patient, What about, see if I have it on here. Should you tell the patient that he has a student working on
Yes.
it? I mean, it could be just somebody with a sprained ankle, or, maybe just a routine IV or something.
I always tell them up front, my name's Jason, I'm a medical student.
My bad,
It's
so that,
mosquito.
So-
Yeah, I mean, they usually pick up on it because they're not dressed the same, or got their
Yeah.
giants, so they're, well, they're like, someone asked me,
Hey, y'all take it down a little bit. Take it down a little bit here.
she asked me if I was from Southern Union's ambulance service, and I was like, yeah. 'Cause she
Yeah,
was
that's what
reading it.
ambulance offers today.
Yeah.
You're not legally required to tell the patient that you're a student because you meet the standard to be on that ambulance, as far as you meet the state requirement. But it's certainly the ethical thing to do, to tell them that you're a student. And they have the ability to say, no, I don't want a student working on you. And just be okay with that. You had that, but probably 95% of the time, they understand that you have to learn like anybody else, and they're usually really good about it. Now, I'm not gonna let you stick me more than twice, well, probably once. If you screw it up, you're probably done, on me personally. But they have the ability to do that. But yeah, do the polite thing and tell them. Your primary obligation is the patient. The patient, your patient. Your student is secondary, so you're always gonna do what's in the best interest of your patient. If that means knocking the student out of the way, you gotta do it. Okay, you're called for cardiac arrest. On scene, the family tells you the patient has a DNR and doesn't want any resuscitative efforts. One family member, wants you to work on him while another is adamant about the DNR. He says the DNR is in the patient's records at the hospital.
but they don't have it on hand.
Keep going.
Yeah.
Keep going.
You working that code?
They don't have it on CS.
What if they do have the DNR there, and the sister is saying, oh, you gotta help mama, you gotta do something for mama, and you got a
Well,
DNR.
if her
wishes
brother's
to-
there saying no, and the DNR also is there, I'd probably go with the DNR this time, because she has support from the brother, and I probably could talk to her about, this was your mom's wishes,
Yeah.
and she put it right here on paper.
But don't family wishes trump the DNR?
No, they have a legally binding
They're gonna
document.
kill you if you don't do CPR.
Well, I
Are
mean,
they gonna
if they
kill
have
you?
a gun to your
What
head.
can you do? What
All
can you
med
do?
control.
Call med control, absolutely. I would probably, if you have any question along those lines, and maybe you have a question about the validity of the DNR, that's a possibility. It's supposed to be in date. If it expired 3 years ago, I'm running that by the physician first, because those, so yeah, you might start the code, call med control, and then he says honor the DNR, and you just stop. So, that's what happened. When can you reveal confidential information about your patient or your call?
Does someone
Only
available
if the
hire
care pertains
care-
to-
transferring the patient?
Transferring care is the key there.
Yeah.
Anybody that's in that chain of care providers, you can share information. When the patient consents to that release, they'll usually have something, you'll sign something that says you can release that information. Legal requirements, if there's a court order, and of course for billing. When HIPAA first came out, they were saying that we couldn't even release that for billing purposes. You guys haven't had to experience that, but that was horrible. They wouldn't give us a face sheet on the patient. We had to go to the patient and get the information ourselves. Fortunately, they found through that. What's the difference between libel and slander?
Libel is written,
Libel is written. Slander is slobber. That's right. You got that right. Does, you have a question? Yeah.
So when you can't give out people's information, how do the police get away with it?
They usually have to subpoena.
No, I mean like, because we have scanners in our truck. We listen to police. When they pull somebody over, they give out all their information over the scanner.
Over the radio?
Yeah.
They shouldn't do that, but that's not medical information.
Okay.
HIPAA covers your medical information.
Because they give out social security numbers, license plate numbers, names, addresses.
Where is that? I want to make sure I don't go
Well,
there.
that's all police departments do, I mean, just
They put a
because
social over the radio?
they can.
The
Yeah.
scanner land? Oh,
They can.
brother. Don't tell me that. Where have I moved? Libel is false written communication. Slander is false oral communication. privacy, here's where you get an invasion of privacy. If you divulge information about somebody, whether it's true or not true, even if it's true, you can't divulge that information if it defames them in any way. You know, they can win a defamation lawsuit. If you publish something in the paper that said, Mr. Jones has AIDS, blah, 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 well, Mr. Jones has AIDS, is that libel?
No,
It's
because
libel.
libel is
Yeah.
false.
Libel's false. So what is it?
It will destroy, might destroy his reputation.
Yeah, so it's gonna be a defamation of character, and yeah, he'll probably win that one. Do we know what the borrowed servant doctrine is?
That's where you're working under that position and possibly they're not gonna get your load.
Yeah, it's kind of like that.
That's where
Yeah.
we're the agents. the secret
We're working
agents.
as under the paramedic, he's,
Yeah, we see this more commonly in a situation like you're working on a truck with an EMT, and the EMT actually is, he's not practicing under you, but you're responsible for the quality of his work. Well, he doesn't work for you, you both work for the same service. So the borrowed servant is you can't serve two masters in that he's working for the service and he screws up, or is he working for you? He's not working for you, but you're responsible for everything that he does. So that's why they call it borrowed servant. You're still responsible for that, and it's a double whammy on the poor guy. When a person has control over someone else's employee, they're responsible for the actions of that person. The crew of a paramedic and EMT both work for the company. The paramedic's responsible for the actions of the EMT, even though the EMT doesn't work for the paramedic. Now, this came out recently. Well, I'll talk about this in a second. In the state of Alabama. You're called to the jail to treat a chest pain patient. The prisoner refuses care, but the guard insists that you take him to the hospital. He says that since he is in their custody, they can make this determination. The patient wants to go. The law enforcement officer says no.
No, I think it's.
No, no, vice versa.
Prisoner doesn't wanna go.
Prisoner refuses.
That's it wrong. Patient refuses to go. The law enforcement wants him to go. Who wins this one?
Patient.
Who has the right? The patient. Who thinks it's the patient? The patient gets to refuse. Nobody?
the right to transport themselves.
What?
You might can take him,
He's
but
in
he can
jail.
refuse the treatment.
Yeah.
Law enforcement says he's going.
Oh, he might go.
He's in their custody. Isn't that what I said?
Then they can load him
Yeah.
up in their
So
car and take him.
who gets the final say here? The patient or law enforcement?
Law enforcement.
You sure? Doesn't the patient have the right to refuse?
Not in jail.
Okay.
I think Brandon is right on this one. Like, if we get in the back of the ambulance and the guard is right next to me and he refuses an IV, I'm not gonna do the IV though.
I mean, that's fine, but to go.
That's what I said.
But to take him to the hospital because he technically is under custody and we're all working together, then I'll take him to the hospital. But I won't do an IV if he refuses that.
Yeah, the state clarified this in our protocols last year, because in the olden days, you know, it was more times than not, the patient wanted to go and law enforcement said no. In that case, who wins?
The patient.
Patient.
If the patient wants to go and law enforcement says no, you have to do what the patient says. Is that what you're saying?
Yes.
They get arrested.
Oh, well, I don't know, I'm asking you.
If they're arrested,
I mean,
Let's
we
see.
live with
How
the
do you get a
guard.
patient, how do you get an inmate out of a jail without their?
That's a good point.
Well, they probably pulled him out for you to assess him, you know.
Yeah.
Anytime you transport a prisoner, you should have law enforcement officer with you. It should be like with you.
They come into the OR with us.
I say the patient because even the guards or law enforcement is not medically competent enough to refuse.
All right, well,
that
let's take
for
a
that
vote.
patient.
How many of you think the patient can say, yes, I want to go, and you transport? It's not as popular. All right, so how many of you think law enforcement gets to say? Okay.
Law enforcement signs the refusal.
In situations where a patient is in the custody of law enforcement personnel, the patient is the responsibility of law enforcement personnel. Patient says, yes, I want to go, law enforcement can say, no, he can't. And you honor, no, he can't. All decisions regarding this patient rest with law enforcement, including destination hospital, consent or refusal of medical care. That's the state of Alabama protocols, which is pretty much the natural standard.
Similar to the opposite. How many
Yes,
inmates
no.
would go
Yeah, I
to?
wanna go to this center in Philadelphia, you know, it would just be ridiculous.
I absolutely would want to, but you know, just say up the street to the hospital, he wants to go because he wants to get out. Or, so how are you gonna manage this? If you think that the patient actually needs care, he needs care, you know, it's a diabetic, he's, who knows what.
I just sugar bottomed out.
Yeah, do what?
Just recommend it to the corrections officer.
Yeah, you gotta make sure you educate him. He's got to be able to make an informed refusal here too. If he's making a mistake, you know, they're gonna be sued and they may lose that one. So you need to make sure they understand that. Call med control, let them talk. The physician says, yeah, he needs to come in, you need to let him go, then they may acquiesce. They bear, once they're under custody, the county or whatever that system is, they bear the cost of his treatment. So they wanna limit these, I wanna go to the hospital, you know, for the flyers.
They can also take them themselves.
They can take them, yeah.
Most of them have their own physician that works in the
Let me
jail
ask.
too.
You know, it depends, someone that just have a nurse there.
Well, I mean, yeah, but I know we have one in
Yeah.
the county, but not for everybody.
The patient that we had the other night, last Tuesday night, he was in jail for buying meth, but the guard said he'd been having stomach pain for like 2 weeks and they hadn't got him any treatment. Well, by the time we got him on the OR table, he had ruptured diverticulum and, I mean, he had like a liter of pus in his abdomen. It was the most disgusting thing I've ever seen. But
I know.
he ended up with a colectomy and a poop bag.
Yeah, not good. So he's probably gonna see somebody.
So
You may win that one.
you know, like the state pays for that, but Dr. Robinson was saying like she's never been in a situation where now what happens, because most people would go in and have a reversal when everything is cleared up. Who pays for that? He doesn't have insurance. He can't afford to.
He'd be suing somebody.
Yeah.
He'd be winning too.
One call, that's all.
So,
That would be called the hammer.
So here's some,
so wait, what happens with our first scenario though? When the guard wants to go?
That's what I wanna know.
patient's going.
Okay.
You load them up, they're
But
going.
on that last slide, it says law enforcement also makes the decision for consent or refusal of medical care as well. My question is, that's fine, I'll take it wherever you want me to take it. But if he tells me, the patient says, I do not want an IV,
I ain't giving it.
okay.
Okay.
Even though law enforcement says, yes, he needs medical care, give him what?
Yeah, but that's not reasonable. Most of the time, it's like either they're going or they're not. They don't really usually wanna tell you how to provide the care, just whether you're going to or not. Let's look at a couple other things. Immunity, exemption from, liability granted to governmental agencies. If you work for a governmental agency, you know, the fire department, oftentimes you have a lot of immunity, whether that's good or bad, I'm not going into. But Samaritan laws are designed for professionals such as yourselves, to stop and render care. This would be when you're not being paid, when you don't have a duty to act. And as long as you act within reasonable standards and not any gross malpractice, you're usually okay. Even if you make a mistake, if it's an honest mistake, you're gonna be covered for that. Ryan White Care Act, which was a nice thing a few years ago, long before you guys, where it requires notification, to your service and to the medic if they've been exposed to some type of, certain diseases, communicable diseases, bloodborne pathogen diseases. We'll finish up here. These are just some different little things. Some of these occurred here in Alabama. A paramedic walked a patient having chest pain to the ambulance. The patient collapsed while walking, arrested, and died.
Wrong.
Oh, it's terrible.
Yeah, oh, that's bad. Does this happen?
Yeah.
You bet. You probably, if you look around people in here, you're gonna know people that do this. You know, they don't want the trouble to have to take that stretcher or the stair share. So don't do it. This actually happened to a fellow I worked with in Pensacola. I knew he was an idiot. 2 paramedics were charged with the wrongful death of a patient that was transported to a local hospital for stabilization. So they went to closest hospital for stabilization, which was 6 minutes away, for not immediately transporting the patient to a trauma center that was an hour and 15 minutes away. The patient died at the local hospital before being stabilized and transferred to the trauma case. Did the plaintiffs win their case?
Probably. Was
Yeah,
air ambulance not flying that day or busy?
Our ambulance never flew.
yeah.
Well, no, if they're unstably transported to
take
the
them to the
closest hospital,
Yeah.
stabilization.
This guy needed to go to the closest
On the
hospital.
route.
He wasn't gonna make it. If he died at the local hospital, he wasn't gonna make it in 75 minutes. Yeah, so that wasn't good. EMTs were charged with wrongful death due to extended scene times. It's a medical patient. Patient died en route. Are you culpable? You stay on scene for 30 minutes, 40 minutes with a patient, they die en route, they would have died where? At the hospital?
Well, it depends on what you're on scene for.
If you got someone who's like they're not wanting to go,
Or what if they're in,
Where the scene is not safe.
It'll be circumstantial,
Okay.
but the point here is make sure that you monitor how long you're on scene, particularly with a trauma patient. If you have extended scene time because you're splitting up, broken bones, bad on you. Paramedics charged with wrongful death. A trauma arrest. They had numerous attempts to intubate were unsuccessful. They used a combi tube, and they stated they successfully intubated. They ventilated, administered medications to the tube. Patient died. Autopsy revealed esophageal intubation. Cause of death, asphyxiation. I don't have combi tube on there. Change that to ET tube. So you gonna win this one or lose it?
I'm here to lose it. You
Yeah.
didn't check your tube.
I hope
Even
so.
a combi tube needs to be checked.
Yeah, and you're stupid. Yeah. EMS personnel admitted to dispatch they were slow to respond to the scene, hoping the patient would die before their arrival. That's on tape. Don't say that on the radio. This happened in Alabama. Patients decompressed of tension pneumothorax with a total of 5 needles. Put one in each lobe.
Oh my
Whoa.
goodness.
3 on the right, 2 on the left.
I guess they wanted to make sure they got the right
Go figure that one out. That happened in North Alabama. You notice I don't live up there for a reason. A medic utilized nitroglycerin spray on a patient with a difficult IV access. We put the spray over the vein, said it would make it dilate.
Well, it makes sense.
Interesting concept, but I don't think
Yeah,
so.
don't think so. What's duty to act?
Properly.
What is duty to act?
You've committed to your shift, you have to respond.
It's a contractual agreement to respond. Formal contractual legal obligation to provide care. Breach of duty?
Not doing it correctly.
Yeah, not doing it or not doing it correctly. Action or inaction violates standard of care. Ta-da! Okay, guys.